Welcome back, everyone. I think we overran in both rooms. Both panels were very interesting and a lot of things to discuss. This session will focus on change. Why is change so difficult, and how can we make it more sustainable? Are there any universal findings that we can learn from, and is it harder in healthcare than in industry? To set us on track, I have the pleasure of introducing Gert. He is a senior consultant who has spent most of his career in the automotive industry. In Volvo, in Scania, in Saab, and in Japan. And he's been studying the Toyota system at close range. What does this have to do with the healthcare system, you may wonder, and patients' safety? Let's find out. Stage is yours, Gert.
I think I had to go back some slides before that also. That's okay. Let's start there.
Okay.
Thank you for this opportunity and to visit you and share little from my experience. After 40 years or nearly 50 years working in the industry, and the last 30 years very much influenced by Japanese. And since 2019, when I retired from Volvo, I continue to work a little bit and share my experience. So what I will do now is to share my experience, and I don't know if I have an answer on this question. I will give my view, what I have seen and learned. And my background, very shortly, is I worked for Saab, and now buried brand in Sweden, making cars. And after that, I worked. Then I learned very much from Japanese, and I worked in Japanese consultant company a number of years. And then I was a part of Scania management team in 5 years, and after that, a short period in automotive passenger cars in Gothenburg. And that my base is the automotive business, which is a very tough business. So you want to earn money and open some business, don't go into that branch. It's terrible at the moment. And most of the manufacturers and companies are losing money. So I will share some slides with you that summarize what I see. Be the change. That's what we started at Volvo Cars, because we need to transform that company. It's in a tremendous need on transformation. And if you want to change, then you have to start with yourself, and that is upper management. You always have to start with the top, with yourself. Because I've seen so many try out for transformations in organizations that they try to delegate the change down in the organization, sending people on training, taking in very expensive American consultants, etc., which is only waste, because you need to do it yourself. I've also been a number of years outside the automotive business, so I have some experience even from your area. And I will say that most business companies, organizations, everybody's unique, but most of them have the same type of problems. Take the next one, see if I come with this. What is very typical if you want to be successful is that you need to have a vision. Not for the coming 5 years, but for the coming 50 years, maybe 100 years. The company I'm inspired of, the Japanese one, have a very long-term thinking. So they are hard to compete with because they always come back. But it's important that you have a clear direction where to go. And everybody should have an understanding what is the direction of the organization. And then comes one of the most interesting things. And if I learn something from the Japanese, it's that you have to start with facts. Facts is very rare. Opinions is very common. Very lot of opinion you can meet in management teams. I know what is the problem. And then you know that they don't have a clue. So you have to start with the current operation and really find out. See, I have some click view. I come back to this picture. And in a Japanese context, I use some Japanese word, go to Gemba. Gemba is where it happens. And I promise you, if you start to study where the value add is, even if it's in a car company, construction company, or in a hospital, you need to find out what's going on. So when I'm working with management team, you have to find out the current situation. And very common in big organizations is that they believe they know what's going on the shop floor, and they don't have a clue. And the higher management, the more misunderstanding it is, because they believe a lot, and they have a lot of control systems with KPIs and monitoring and so, but they seldom go out. Last week I worked with a company in the north of Sweden, and we spent 3 days just studying what's going on. And then we start to understand what is the problem. And it's not 1 hour, it's days. And I promise everybody is surprised when you do this, special upper management. In a Japanese context, you will never ever be promoted if you don't know the business very well from the ground. But in our environment, you can make a career with just have a brief opinion what's going on. So this is very important. And this is the most fun that you can do. Because I say facts is rare. Opinions is very common, even if from well-educated people in the hierarchy. See what comes up here. Yeah. So what I done at the moment, are doing at the moment, after my 30, 40 years learning, because I'm still in a learning curve. That is, if a company, in this case, maybe you know this, Lærdal Medical Systems in Norway, we had a 1 week of management training. Then we start to study and study and study what's going on. And after some days, we had found 255 problems. Not big problems, but irritation for the one that makes the job. And if you don't see what is the irritating moments for the people on the shop floor, and you as a manager must have the ability to solve this. Here we are in a process, 255 problems found after 2 or 3 days, only 21 solved. That is one of the most basic skill of a manager, solving problems. And that starts with facts. And this is amazing to do, because this is a very good company. And often you know the big problems, but the small ones, that means that this guy working there has problem with every minute, every time. They are still tend to continue to be there. It's the same with a big Swedish company in making cars in Gothenburg. They believe that they are very good in this, and a lot of engineers have worked with the process, a lot of other staff functions, but very seldom involving the operator. We are really poor at that in Swedish industry. We are very democratic, but we miss the point. And that is to involve people in human development for real. So finding problems and solving them, that is human development for real. And then coming back to this one, then I will say that when you have a clear direction, make it very clear, and you study the facts, then you know what is step 1. But you can see this before the election a couple of weeks ago. There were nothing about the vision, nothing of the current analysis of facts, only ideas what to do without having defined the problem. Start with knowing the problem, and you will see what is needed. It's the same in the industry. It's the same, I think, in the hospitals, etc., and everywhere you are. And if you want to make a transformation, the upper management must have the ability and knowledge and brave to go down in the production. A truck maker in Södertälje, I don't know, mention the brand, but when we took out the management team there, they were so surprised. The first day, there's a lot of problems we have. Fantastic. After the second day, we have very many problems. Okay, we try a third day. We don't want to see more problems. But then you really come deep into what we have. Then you can turn it around and start coming up with solutions how to make things better. So that's why this is so important, this picture. Okay, then I have a slide. Once upon a time, I was working also as a designer or product engineer at Saab. And I learned this picture from there. It has been the same at Scania, same at Volvo, same at many companies. I see that is, if you are promoted from the level where the value is added to the first level, this is a big company with many levels, too many levels, but that's a normal thing as a big company. Then you start to spend time in meetings. And the next level, you spend even more time in meetings. The day is longer with more meetings. And if you're at the top, you don't have even the weekends free, but you spend in meetings. This is not what the successful company, the good ones, are looking at. Because there you know that if you're not engaged in what's going on the shop floor as CEO daily, you don't know what you're talking about. So it's very important, instead of spending time in meetings, because it's 90% non-value add to spend time in meetings, is to look what is needed, what it is to improve, what do you need to improve, what is your role as a manager, and then you can start to work with a strategy. Instead, to the left, I have used this picture for many years, and I see it too common. You think and you believe and have opinions. Here you have to have facts. And this is maybe one of the most important change to do. I don't comment a number of levels, but very often you have too many levels. And I never ever had any problem with change of how you are working on the shop floor. Always positive. But if the top manager not on the track, they will kill this initiative. That's why it's important to have this combination. This is maybe some of the what I compare. Very typical is that management delegates the change to subordinates, or in worst case, to very clever and expensive consultant companies. I mentioned the name here also. Because you can never have a change if you don't show the change by knowledge from you as a manager. Another thing is traditional budget and cost control, which we have in too many cases. That is also something like looking at the weather report in that level. Maybe it's better tomorrow. Focus on reducing waste. What is going on in the business? You need to have a very clear direction. And if you have a clear direction, you need to follow up with actions. Otherwise, you have this bohica, bend it over, here it comes again, which you maybe have been in that type of environment. So clear vision and mission. And reorganizations is only a cost. Use the organization you have and do the work. Let people develop. The company I have been studying most, Toyota, very conservative. They never changed the organization, but they changed the work every day. That's the difference, based on what is the business aim of the business, and have long-term target, 50, 100 years, something like that, generations. Some examples that I have been in, and Aslak Iversen, he's working as a psychiatry manager in Holland. It's an amazing organization. They have working now for 6 years for transformation, and he has done a fantastic job. And then we have a Saab, not a jet fighter, but the civil one. They make also a big change, so they have survived and been growing. And then, of course, Scania. But these three have done it, the people involvement for real. People involved on the paper, every company has. Values on the walls, every company has. But that means nothing. It's how you act as a manager. And then coming back, because it's my last slide, coming back to the question, so I don't forget it, is it easier to change organizations within industries than in healthcare? I don't know, but I don't think so. I think it depends very much on the management, because the cases where there have been real changes, the upper management is very important, how they behave. And you can change it in both healthcare organizations, in companies that are private, etc., etc. So I think it's very much the behavior of the management. If I have the opportunity to come into more in the hospitals, I've been there sometimes. I know you have some problems there, but the companies like Scania and Saab and ABB and others, they also have problems. That was my short introduction. If you follow my special English speaking in Trollhättan, Pernilla knows very well how to understand this, but if you're outside Trollhättan, you seldom understand English. We know that for General Motors. Yep.
Thank you, Gert, for sharing your experience. You talk about being the change. Another translation of that is walk the talk. I'd now like to welcome Margareta Danelius to join us on stage, please. Margareta is Chief Medical Officer at Capio, Sweden. She's a doctor and a leader with extensive experience in change management, patient safety, and digitalization. She's been leading healthcare in hospitals, in primary care, specialist care, as well as online in public, private, and non-profit settings. What are your reflections? Is it easier to drive change in industry, do you think, or in a healthcare setting, or are there similarities between the two?
Big question. Thank you very much, and thank you, Gert, for your interesting talk. I'm a very naive person, so when I hear something, I always think that is completely right, but I will still try to challenge you a little from my experience, because when you say go down to the floor and solve the problem as a manager, I don't think that is exactly my experience. I think in our hospital, St. Görans, which were very early to adapt to what was then called the Toyota model. I know usually we use other words now, but they started with the lean production, with making the changes at the units together with the patients where you know the business. We still work there with these improvement boards, you know, the whiteboard where you put the post-it suggestions for making it slightly better every day. Nowadays, we also take from the patient surveys, the free comments that they give, they are also put as a post-it sign. It's a virtual post-it nowadays, but still. So I think that lots of the improvement and the development is best done at the units. But for me as a manager, I agree with you completely that I need to be there. And I need to be there for several reasons. And one is to make sure that my staff have the resources to do this, the technique, what they need. But another one is that it can be very ineffective to let all the units develop for themselves. I mean, they share lots of problems that it would be more effective for us to solve in the same way. So as a manager, I need also to be the networker and to hold this together. I can personally be the spider, like when I'm at one unit, I say, well, you know, you should talk to these people, they had the same problem. I also have to create the areas, the meeting areas for the different units to talk to this. And also I have to work with the communication on intranet, on social media for everyone to know what people are doing. So that would be my reflections.
And it's good that you take, I know the guys, I met them a couple of years ago from St. Göran, by the way, really interesting. But what I'm thinking of when you're saying what you're saying is that we had a period in Sweden that everybody should be some self-controlled groups. I would say it's a terrible period where we spend a lot of waste. Instead of supporting the teams as manager, we let them do what I find out best in the industry. And it was a former very famous Volvo manager who implemented that. And we still have problem in the industry with that. So it's very important, you must give a direction. and then you follow up. And as you say, as a manager, you need to coordinate that on other levels and also as networking. But you need to understand what is the real problems. But people will develop. That's what I said before. Not be too democratic, because then you went in trouble. The manager set direction and coach you, and people will grow.
Yeah, you are right. And when you say that, I see sort of this balance line between abandoning the staff and directing the staff, and that you have to somehow find where is the right spot to be on.
In our previous session, we talked about patient involvement. Does the patient come into play in this post-it suggestions as well, or their suggestions for improving the care? Is that part of the equation?
It's part of the equation, and it's getting more and more of the equation. I think 10 years ago we trusted mainly that our staff would know the patient so well, so their input would come that way. Now we do it in a more structured way. When we have this patient experience follow-up, we also ask the patients for their free comments, and in that we often get very concrete, small things to make better, and then they go into these charts and these boards for continuous improvement. But I think nowadays we also have to involve patients on the management level, because those comments are usually about their own care, but we have many patients engaged in the structural changes and in innovation that we need to take care of. And that is more a role for the management. And when we do that as a management, involve the patients, it's also being a good example. When we show that we do that, it will help staff also to involve patients in everyday work, I think.
Yeah, you write in your profile that the patient is your best partner or foremost partner. How is that evident in the decisions you take and how you drive change?
I think my patients really, the individuals that I have been taking care of, I could name some of them that have really been better teachers for me than I had in med school. And actually, to keep myself always on my toes, I spend a lot of time with patients. I work a little clinical, but also like last Friday, I had lunch with a former patient just to tell her a little about what I'm doing and hear her reflections. And I think that always helps me. It's so easy to get stuck in your own perspective. And it's not dangerous to listen to others. You can just skip it if you don't like it. But often I don't need to do that.
Can I take a metaphor on that, as you said? Because once upon a time, working with General Motors, a big company, we compared the product development with Toyota. In the big General Motors, we have a handbook how to develop a car. Start with page 1, okay, page 2. But in Toyota case, they traveled around in US to all 50 states, meeting customers and dealers before they start. But you don't need that in General Motors because you had it in the book. And I think always talk with the one that used the product. And I think it's a gold mine with patients also. Yeah.
That's right.
Margareta, you've worked both in publicly financed healthcare settings and in private. Capio is privately owned. Do you think it's easier there to drive change than it would be in a big state-governed hospital? I think it's a little easier, but I don't think that is necessarily connected to being private or being public. But I think in Capio we have managed to have a rather flat organization, and we managed to take quick decisions which the staff need if they can really drive the changes. And one thing I thought of in your presentation was that you have to stick to your organization. You can't reorganize all the time and think that you will do a better work. And I think that might be the problem with public healthcare, that due to the political changes, there is always a change in organization going on. I mean, every time you come to the region, they will start with a slide with, now we have organized it this way. And of course, that is not a very sustainable way for change management, I think. True. Sometimes the pace of change is relatively modest. You go by your improvements, both in industry and in healthcare, but sometimes you have to change at the flash of lightning, like when COVID struck, and effectively all other healthcare was put on hold. How did you deal with that? How did you organize the hospital?
I would say we flattened the organization even more. We made shortcuts. The staff needed to adjust directly to the COVID patients and put everything else on side, and they did. But we as a management needed to every day help them with the new routines, help them with the resources, help them with decisions that we otherwise would have said, have a discussion and see what's best. They couldn't, it was not possible for them to handle that in everyday life. So we had to communicate very, very quickly, give them and take responsibility for the routines. No one was sure about which was the right routines, but I as a manager had to take that responsibility and not leave it to them there. And that worked out fine, I think. One interesting thing is that one thing that was a little lost was the patient involvement and the family involvement. There is a very touching sommarprat, summer talk on radio 2 years ago by a nurse who really apologized to people that we didn't have time to involve family, we didn't have time to inform you. But what we did in Capio was, there was one unit that didn't have anything to do, our innovation hub. Everything stopped when pandemia started, and the innovation hub said, what should we do? Later they came in for testing, vaccinations, lots of things. But there, in the very beginning of the pandemic, they didn't have anything to do. So we asked them, please try to involve the patients. So they had these open chats with patients, asking questions about what's happening. They arranged webinars that we sent on our intranet, asking the patients, what do you need now during this new situation?
So what is the situation now with a huge backlog of elective surgeries that have not been done during the pandemic? How have you organized the care any differently from in the past? Have you learned anything from how you managed things during the pandemic that could be useful in a more normal situation?
We have learned a lot, but I think sometimes it's overestimated. People say that what we did, it worked so well, we collaborated so well during pandemics, but I think that is sort of natural. In a catastrophe you do that, and you cannot live in a catastrophe. You cannot have that as your driving force. I know from other catastrophes, from Utøya in Norway, they had this immensely well-working emergency care, and they said, why don't we work like this all the time? But we shouldn't wish for that, I think. That's a stress that we can't live with. But I think we have learned some things about the balance. Where is it interesting for everybody to have common routines and common ways of seeing things, and what is better done out on the units?
I think one reflection on your speech, Gert, you mentioned Karolinska resorting to consultants. I think there are good examples also from Karolinska during the COVID care, where they actually made the doctors and the nurses and everybody organize the care, which was much more efficient than would have done. So they were able to treat many more patients. So that's evidence of the fact that let the people who really know the business do the business.
I would it be dangerous to put a name in there, but it was so public about the idea that I've seen it and been it myself also, when you put in these big companies, consultant companies, try to transform an organization. That's why I put it there. So, I can just underline with you that the routines or processes are very important, because I had this hierarchy quite deep here, and you can maybe take away 1 or 2 levels, but then you need clear processes and coach people in.
Can we spend a little time talking about some other changes? I know that you've been very successful in developing a prostate cancer center, where you've introduced quite a lot of change, which haven't been fully funded by the public money that you receive. What are the key success factors there, and what were the difficulties?
I think the key success is what you also mentioned, facts. I mean, this was hard research that really proved that there were better ways of screening for prostate cancer that could be more available to people, to men who needed it.
Can you describe briefly how it works?
It's a test that is very more accurate than the classical PSA test, a test that is called Stockholm 3. And since there is in Sweden not yet any general screening, it is still okay for everyone who wants it. And I know the people at the unit say it's usually not the men who want it, it's their wife, they say.
Here we come back to the involvement of the families. But it's not only about the test, it's also about the process and a digital...
Yes, the easy availability, how you can just do everything online yourself, but there is always an option to be able to talk to someone, to a nurse or someone else if you have more questions. And then there is this very clear algorithm for when you go further to have your MR investigation, what happens if it shows this, what happens if it shows that, and that gives a very good also security for the patients. They know exactly what will happen in the next step, and if nothing will happen, they know when they are recommended their next follow-up.
So what are the key benefits to you as a healthcare provider by doing this, and to the patient, would you say?
We get better results, and that is, I think we haven't mentioned that very much, but in change management, of course, everything has to be measured, and not only measured, evaluated.
Yes.
I think we are rather good at doing it, at measuring it, but we are not that good in taking the consequences of what the measures show. But I think when it came to prostate cancer, we did that homework as well, and could try, test, measure, and then redo what needed to be redone.
What about the cost? Is it more costly or less costly or comparable to before?
It's much more costly if you just see on the tests, but for health, it's well worth it.
Are there any questions from the audience? Yes, Sven, please.
Thank you for wonderful presentations, and I very much like your approach, driving data, that they are very important. I would like to add another point that is fostering the healthcare workers in the process, because as you mentioned, these people know what they are doing and we must learn from them. I had a long time dealing with violations of processes, dealing with that. And all of a sudden, the American NASA contacted me for a scientific exchange. And they invited me to go to Palo Alto for some time. And I've been there, and we were discussing the complexity of businesses and the question of when to violate a standard. Because in healthcare, we have thousands of standards. We have guidelines everywhere about everything, but we cannot cover every situation in healthcare. And the question is, at what point is there a violation valuable? Because when you know the outcome and the outcome is good, the violation is okay. If the outcome is bad, the violation is not okay. So in the situation, you have this problem as an expert when to violate from that situation. And that was the reason why NASA contacted me, because they have the same situation in going to space. When should the astronauts be allowed to deviate from a standard procedure? And I think this is very important even in healthcare, because healthcare is at one point very complex. I completely agree that we can cover a lot with standards, and we must do it, especially for the training and everything. But we have situations, mostly at nights and mostly at the weekends, where we don't cover the whole situation with a standard. And then I must rely on my team that they are capable of dealing with that situation. I think this is a very special situation in healthcare. Any comments?
Is it okay to deviate from guidelines in a critical situation?
See if I follow what you say. I think, can you help me, support me,
Sure.
what you're after? Yeah.
So in a critical situation, there are guidelines for example, astronauts and others, but sometimes there are critical situations which are not really covered in the procedures and the guidelines. Can you trust your team to make the best decision then, and would they be allowed to not follow the guidelines?
If I take it from my experience, is the more you can standardize of the normal work and train your people, if you say, and the more you can keep this, if this is the work, the more you can make this predictable and standardize, the easier you can handle with these more complex situations that will come, because they will come everywhere. If I follow that, so because you can't have chaos, and in chaos come in another chaos.
What's your view, Margareta?
I think it's a very interesting question, and I think actually that is one of the central things for development of healthcare. When do we benefit from standards and doing things the same way, and when do we have to individualize it? And I think that is very sort of put to its point with digital tools. As you said, I have been working with developing a chat function, a digital healthcare, and there we based it all on very, very strict standards. But our staff were always allowed to do exceptions, to do it in an individual way, but they had to motivate it in the patient record. So to do that, as long as you think, as long as it's a planned decision, a planned deviation, I think that not only can be done, it should be done, because that helps patient safety. But I think it's a $1 million question when.
Yes.
Maybe I don't need a next microphone, but I think this is the most very interesting question. And I would say this is the investment in the people. Because in some, like, you can have a guidelines, but on the other, you must invest in people. They know how to deal with the situation. I am a physiologist in the Netherlands, and you have some situations that cover these guidelines.
I think we have people remotely, so if you could use the microphone and repeat your question briefly.
So I was just a comment, because this is a big question, and I think this is the problem, to invest in a people, because you can invest in the guidelines, but sometimes the people must decide, and if you invest in a people, if the people are working in teams, maybe they make the correct decision when you don't know even you don't have a guideline. Like a landing in a Hudson, there was not a guideline. It was just the skills of the pilots and the combination of the whole team that it was successful. There were no guidelines. Thank you.
I can agree, but I don't think there is any difference in different businesses. What I can say from my world is that one of the most important thing for the best in the automotive is the building the people's competence in the company. Why does Toyota never fire their people? Because there is the competence.
And I think also learning by doing is a core to that philosophy. And learning is a lot about not always being successful, but sometimes also having failures or less successful projects. Are there any projects that you've run that haven't been as successful and where you've learned to do things differently?
Yeah, unfortunately many. But I think compared to the industry, for healthcare services, I mean, patient safety is the risk analysis. You cannot try on your patient things that have not really been risk evaluated. Maybe if the car doesn't work, you just can't sell it.
But never try. It's the same. Sorry,
it's the same in some way. I would say this is a very simple example, but just from this digital services, we set up, when we started it, 20 easy procedures from primary care that could be handled online. And then we let the GPs look at them. And it ended up with 19, because the one we had for pain in the ear was skipped. That just wouldn't work to have it without seeing the patient. So we have to abandon that. Then we went on and we had testing of skin black spots. And the patient could go to the primary care center, have this dermatoscope, and it was sent to the digital doctor. And that worked out fine, but the patient thought that was completely a hole in the head. You would go to the primary care center, then go home and talk to them online. Why would you do that? So that is something we skipped as well.
What about involving your staff in change? Are they all open to change, and do they all want to jump on the wagon of change, or do they sit back and try to hold on to what they're used to?
In Capio, everyone loves. No, I'm just kidding. No, of course. I mean, we are all different personalities. We have all different experiences, and of course that affects us on how open we are. An example from this digital world is that when we were going to start that in our units, we tried and tried and tried, but the units just couldn't make it. It was too tough when you had your ordinary business going, and there was a too big skepticism towards the digital tools. So then in Capio we decided to do this in a completely new small organization that would work on the side until the technique was good enough and it was safe enough. And that is what we did. But already before it was ready to be handed over to our primary care centers, they started looking at it. And they were sort of a little jealous now. God, they are doing it. We should be doing it. So there became sort of a competition, like, don't let them do it. We will do it ourselves. Of course we can. And that really drove transformation. And people that had been very skeptical said, this is now, when we have developed it, it works fine.
Great. There's nothing like competition to drive change. I think we need to wrap up. We're running a little late, and I'm conscious about your lunch. But maybe Gert and Margareta, if you just were to share, what are what would you say that is really needed to drive change?
A leadership that believes in the people and challenge them, and also expect participation.
Thank you. Margareta?
Yeah, I would also go for the dialogue, and I thought when you were saying that we shouldn't have meetings, I thought of a story when my son was young and he couldn't go to school, so he went with me to my job where I was a manager at a medical clinic, and I said, you have to go with me to these meetings, but you have to be quiet, you have to draw, you have to whatever. And so we did, and he spent the half the day with me, and we did all these meetings, and then I said, great, you behaved well, now let's go home. But he said, but what about the meetings? And I said, but we have been to all the meetings. No, you have just been talking to a lot of people, he said. And then I thought, I also think meetings are boring and not for good, but meeting is actually talking to other people, listening and talking, and we should continue with that.
Yeah, for some reason we have 2 ears and 1 mouth. Let's use them. Thank you, Margareta.
Thank you.
Thank you, Gert.
Tack så.